you can sit in any room. You just need to believe it, and you just need to work hard. And I'm a living example.
Sky is not even the limit. Sky is not even the limit.
My name is Dr. Elizabeth Wangari Itotia, and I'm a radio pharmacist. I grew up in Limuru, a village called Murengeti. So I attended Murengeti Primary School up to class 6. And then from class 7 and class 8, I moved to Tigoni Primary School.
She managed to get KCPE 370 marks. And she was very frustrated. She was not expecting that. She expected 400 plus and was admitted to Loreto Girls High School, Kiambu. And when she went to Loreto, I actually talked to her and told her to prove the examiners wrong because she thought they had failed her. When she got to Kiambu, she worked very hard. She was an all-out girl. She was a head girl. So many responsibilities. And I even once went to complain. I thought she was overburdened, but she told me she would cope. When she was in her Form 4 April, she traveled to UK for an exchange program. That was her first time to get out of the country. We were also very proud when she got there. She even featured in a gazette there, explaining about our social affairs in Kenya. She met with a council of elders in UK, that is Ireland.
I scored an A, and during selection of courses, for one reason or the other, I found myself choosing pharmacy. So this choice was not random. I did this because I had heard people are dying of cancer. So in my small self and my very young self, I thought that if I do pharmacy, I'm going to be able to discover a cure for cancer. What I knew is that I did not like farming. So my dad used to wake up early in the morning to go either plant potatoes, harvest skuma wiki, to go and sell in the market, and I hated it.
She hated going to the shop. She never liked going to the garden, especially when it is working there.
I have nothing against farming, but I hated it. So my grandmother one day told me that for me to get out of that, if I ever want to get out of that, the only way is to work hard in school. And I was young, but I took that seriously. So wherever I was going, I was making sure that I was the best.
I remember she was very disciplined with her studies. Even on Christmas Day, she will still set some time aside to go through her book.
70 to 80% of her time she dedicated to her books.
My decision to become a radio pharmacist, or what most people nowadays are calling a radiopharmaceutical scientist, was based on my passion for cancer. However, it started with a Bachelor of Pharmacy. So when I did my Bachelor of Pharmacy, I realized with this degree, I'm able to make an impact in the healthcare world, but not as much as I want to in the cancer world.
When she gave her first press conference, we were all glued at the TV. That was the NTV. She gave her first conference before she graduated.
Knowing even if no one is telling me to go to class, I am going to class. Even if no one is telling me to read, I am reading.
I graduated as valedictorian. So I was the best student in the overall university for that graduation of 2017.
We were so happy. We had no words to say. You can imagine we were given VIP cards. We would get where the president gets in, where the VIPs, that is the vice chancellors and everybody else, would get in. All the students huko ni makofi tu, walikuwa wanashangilia mpaka tunashangaa. Is she the one who is making this crowd so happy?
But because of this thing of being valedictorian, there were a lot of opportunities also that were being thrown my way.
All of them were willing to work with her. The best thing that I found was that acceptance, kukubarika. Everybody now wants to be associated with her success?
So one of them was to pursue radiopharmacy. So this pursuing radiopharmacy was not something I've always thought. I've always wanted to become a person in the cancer world, but not specifically a radiopharmacist. I did not even know there's a career path called radiopharmacy.
We've seen her determination ever since she was young. Mostly as kids, most people run to do wild things, being defiant. They want to play all that, but for her it was a bit different. Most of the time she was in her books.
You can see there have been determination from the word go. She was ready to go an extra mile, always.
I was tamaking, okay, I didn't have a job. So I got a scholarship and I got a job the same time, 1 week difference. So I got a job offer like today to join KU referral as a pharmacist. And then 1 week later, I got communication from the people I applied for a scholarship that I have a scholarship. And so I was in a very difficult situation. What do I take? Do I take the job? Do I take the scholarship? So people are telling me that time those are good problems to have. But things worked out because I was able to convince KU to let me go and come back to them, because that time they were in very advanced stages of introducing nuclear medicine into the hospital. The practice was not yet there. I proceeded to South Africa. That's where I did my master's to become a radiopharmacist. So in 2022, I officially became the second person in the country to become a radiopharmacist and the first female to be a radiopharmacist in this country. A radiopharmacist is a pharmacist who, in very, very simple terms, works with drugs that are radioactive. So you have your normal maramoja, you have your normal, which other drug is not piriton. So we take that maramoja and we take that piriton and make it radioactive. Okay. So radiopharmaceuticals, in short, are drugs, because a pharmaceutical is a drug. So radiopharmaceuticals are drugs that are radioactive or that contain nuclear material inside them. Okay, so why are we using radiopharmaceuticals, or what's the big deal about radiopharmaceuticals and radiopharmacists in this country? Okay, one, radiopharmacy is a specialty under a branch of medicine we call nuclear medicine. Okay, so a radiopharmacist is also called a nuclear pharmacist. So we administer radioactive drugs to patients who have various conditions. But our main application in this country is we administer this medication to patients with cancer. Okay, so traditionally, cancer management in this country has been a patient, presents to the hospital, and then there's like a growth somewhere. They go and they're imaged with your CT, with your MRI, and your MRI is able to show there's a growth growing somewhere in your hand, so something needs to be done. They send for biopsy and they confirm maybe it's cancer or it's not cancer, because not all growths are cancer. Yeah? Now with radiopharmaceuticals or with nuclear medicine, we are able to see before you even get that growth. You're able to see that you will get the disease or there's a malformation in that specific part of the body before even the tumor grows. However, you cannot come to us and tell us, I think I might have a tumor in this place of the body, please test me. Why? Because we are using radiation. So radiation is dangerous. Not in a bad way. Of course, you use radioactive material that will not harm you. But in medicine, there's something we call justification, that we will not expose you to any medical procedure unless there's a very big medical justification as to why we should expose you. Traditionally, patients have been going to India to get these types of scans. So Kenya has just recently introduced the technology, so our patients are still able to get this imaging modality. That does not mean that radiopharmaceuticals are only used for diagnosis. We also have some radiopharmaceuticals that are used for treatment. So we know you have breast cancer, you have prostate cancer, you have something called neuroendocrine cancer. So we administer you with very high doses of radioactive drugs. So we take that radiation specifically to where your cancer is or where your tumor is, and then we're able to irradiate or deliver radiation to that tumor cell. And we're able to kill the cancer cell and increase the survival of the patient. So I think I'm pursuing my childhood dream still. But the question that someone would ask themselves is, what is the impact of these radiopharmaceuticals in, healthcare, for example. I've told you about diagnosis, but there's also assessment of treatment, yes? So a patient is going through chemotherapy, radiotherapy, whichever modality of cancer treatment. So we want to see this chemotherapy that this patient is getting, is it working or is it not working? Can we change it mid-cycle? Can we do away with it and tell the patient maybe we just need to manage your pain? So we also use radiopharmaceuticals to be able to do that. Sometimes a patient is free of cancer, and then any patient who has ever been diagnosed with cancer is always advised to come for annual or biannual, depending on the type of cancer we're dealing with, reviews. So that we detect in case there is recurrence, or what we call remission, okay? If the cancer has recurred. So we are able to use radiopharmaceuticals to be able to detect whether your cancer has recurred. You had prostate cancer, after a few years you feel something, or some of the tests that in the lab are not doing well, you come, we inject you with the radiopharmaceuticals, and you're able to tell, has the cancer recurred or has it not recurred? Since the introduction of nuclear medicine in this country, we have been able to see, give or take, 15,000 Kenyans. This therefore means these are Kenyans, some of whom would have gone to India, and that probably would be 100 or 200, and the rest of the 15,000 would have been managed without this modality, because most would not be able to afford.
She is setting a pace to remind women that they're allowed to dream, that dreaming is free. No matter where you're from, you can achieve anything you want to, so long as you set your mind to it.
And I don't take mentorship easily, because it means that person is really looking up to you, or that person really wants to become like you, but the goal is for that person to become better than you. I would say I'm where I am today because I was mentored well, and I was mentored well specifically by women. I've been held, my hand has been held by both men and women, but most of the doors that have occupied, most of the rooms that have occupied, those doors have been opened by women. And those women, it's because they have been very deliberate in holding my hand. I play chess. I used to play chess professionally. At a professional level, I'd even have a trainer, I'd have books to train on chess. Most people don't think that chess has books, yeah? So I'll have books, I had bought books. So I love chess. But I might have dropped that ball with the medical career picking up, because chess is also as involving as taking a medical degree if you want to play it professionally. You can sit in any room. You just need to believe it, and you just need to work hard. And I'm a living example.